How does body image connect with plastic surgery choices? Many people think about changing how they look at some point in their lives, but what really influences that decision? Body image plays a big role in whether someone considers plastic surgery. Body image is how we see ourselves, what we think about our appearance, and how we feel about our bodies. When someone isn't happy with their look, they might think about surgery as a way to feel better or more confident. But this connection is complex and shaped by many factors. For some, dissatisfaction with their appearance can be mild, like wishing their nose was a little smaller or their skin clearer. For others, it can be more severe, especially in conditions like body dysmorphic disorder. People with body dysmorphic disorder often obsess over small or even invisible flaws, feeling convinced their appearance is deeply flawed. Unfortunately, surgery usually doesn't fix these feelings and can sometimes make them worse if the underlying psychological issues aren't addressed first. Psychological factors are very important. Research shows that people who are unhappy with their bodies are more likely to seek cosmetic procedures. Those with body dysmorphic disorder are at high risk of pursuing surgery, but because their perceptions are distorted, surgery often doesn't bring relief. That's why plastic surgeons carefully screen patients for mental health concerns. They need to ensure that surgery is appropriate and that patients have realistic expectations. Managing these expectations and recognizing when surgery isn't the right choice is a key part of ethical practice. Social media also has a big impact. Platforms like Instagram and Snapchat flood us with images of what's considered beautiful, often digitally altered or filtered. Seeing these perfect images repeatedly can make people feel dissatisfied with their own appearance. Some may even develop a desire to look like their filtered selfies, a phenomenon sometimes called Snapchat dysmorphia. Studies show that higher social media use correlates with increased interest in cosmetic surgery and a desire to achieve those idealized looks. Cultural and societal influences shape what we see as beautiful too. Celebrities and media often promote certain beauty standards, which can influence who chooses to have surgery and why. Sometimes people pursue procedures to meet these societal ideals without fully understanding the risks or having realistic expectations. It's important for both patients and surgeons to consider these influences carefully. From an ethical standpoint, plastic surgeons have a responsibility to prioritize patient safety and well-being. They must assess whether a patient is psychologically ready for surgery and whether their expectations are realistic. If someone's body image concerns stem from a mental health condition like body dysmorphic disorder, surgery might not help and could even harm the patient. In such cases, referring the patient for psychological support is the best course of action. Surgeons also have a role in promoting healthy body images and helping patients make informed choices based on realistic goals. In summary, body image dissatisfaction, driven by psychological issues, social media, and cultural influences, strongly influences decisions to pursue plastic surgery. It's essential for surgeons to evaluate these factors carefully, ensuring that patients' mental and physical health are both considered. By doing so, they can help patients make safe, ethical, and informed choices about their appearance. Always remember, consulting healthcare professionals is the best way to address individual concerns and get personalized advice.